Hi guys, this is Jordan, and I'm going to be focusing on brief psychotic disorder, but specifically with postpartum onset. Um, so, what is brief psychotic disorder? Just a quick overview. It is the sudden onset of any psychotic symptoms, including delusions, hallucinations. Those are usually the most common. Disorganized speech or catatonic behavior. The negative symptoms aren't as prominent in brief psychotic disorder as they are in long-lasting psychotic disorders. And as you can see, this one can resolve after even one day and doesn't last over 1 month. So people can really like return to a normal level of functioning, which I think is super interesting. And it is slightly more common in women than it is in men, and this may be because of the psychosocial stressor that is childbirth. And yeah, I'll get more into that. So, childbirth can be a major stressor physically and emotionally. And those traumatic events is what can cause like a break of psychosis. So, within 4 weeks of delivering a child is what is considered the postpartum onset with brief psychotic disorder. And that is when you'll see positive symptoms emerge. And even late postpartum onset is when it occurs 4 to 13 weeks after childbirth, but it can still resolve really quickly and be like one episode and last less than a month. And so the estimated global prevalence of this is 0.089, which is pretty small. And it often does go underdiagnosed and underreported just because a lot of women aren't like screened, and there's not like a bunch of screening procedures during like those prenatal and postnatal periods. So the majority of people that experience this have no prior diagnosis of a psychiatric disorder, and like it's always described as being really sudden, which is kind of scary. Like I think it's really interesting, and but it can be followed by a diagnosis of bipolar disorder. So that is kind of common. Um, so I'm going to talk about some risk factors. Of course, a family history of having a psychotic or bipolar disorder um, is a very important risk factor. I feel like not even just with childbirth, but just being careful of that. It does seem to happen more often with single mothers giving birth. Um, so yeah, that maybe just is also due to like the stress of having a child. Sleep deprivation is a causal trigger. I think that that has to do with like dopamine, and I guess that's where some of the negative symptoms would come in, is like when you're not sleeping, not eating, um, and having an episode in response to childbirth does heighten the risk for relapse and future pregnancies. So if it happens once, it's you have to be very careful with the next pregnancy. But obviously, there's limited things you can do while you're carrying a baby inside of you. um, the dysregulation of the immune system does make people more vulnerable, and it's more common in those who don't have T cell elevation, as well as those who show an elevation of monocyte levels, which are basically just white blood cells, and usually happens like as a result of infection. So those are just some things that are common. And now I'm going to talk about treatment. So the mothers who are at risk to harm themselves or the baby usually do require hospitalization. And that tends to happen more in postpartum psychosis, which is just more severe. I think I talked about that. But brief psychotic disorder with postpartum onset does usually respond pretty rapidly to treatment. So um, it is different. And mood stabilizers and atypical antipsychotics are the first go to with providing medicine. Sometimes women have to abstain from breastfeeding due to like the medication that they receive, which is, I think lithium is the most popular one that doesn't allow for breastfeeding, just because You don't want to have lethal levels going into the system of the baby. And then just psychotherapy alongside taking medication really reduces the positive symptoms and helps learn coping strategies. And this is an easy way to monitor progress and prevent reoccurrence. So um, even if like all the symptoms resolve, you can have more treatment. Um, and that also helps just prevent the diagnosis of further psychotic disorder. And there are my sources, and that is all.